Okay, class. In this video, we are going to discuss diarrhea. Diarrhea is one of the most common diseases that may happen around us. For the mild diarrhea, or if someone ate something wrong or improper diet, and the second day got diarrhea, for the mild situation, sometimes you don't even need a treatment for that. The problem may be healed automatically. But in the other situation, if the patient suffers from diarrhea, comes and goes, and constantly have diarrhea, then it will become the diseases that we need to pay attention to. Diarrhea, similar to the abdominal pain. Chinese medicine and acupuncture, we understand diarrhea as early as 黄帝内经. There are some articles and some texts that discuss on diarrhea, and also it explains the possible causes of diarrhea. For example, still in the discussion of pain in 黄帝内经, in that article, it described as the coldness attacked the small intestine, and then the function of the small intestine will be affected. The patient may result in abdominal pain and diarrhea. So why 黄帝内经describes so? You need to think about the function of small intestine from the 脏腑 theory. Distinguish the clear and turbid. So it's the function. If the coldness attacks the small intestine, the patient may result in diarrhea. In another text, in 黄帝内经, you also describe the symptom of diarrhea. How can we know excess or deficiency, or how can we know the nature of the causes? For example, if the patient needs to go to the toilet urgently, and after 1 second, the patient done. So in this situation, the patient passes the stool urgently, like liquid. This is due to excessive heat. If the patient still got diarrhea, got loose stool, sticky stool, it's due to dampness. So these are some manifestations or some symptoms that the patient may tell you. If after diarrhea, after passing the bowel movements, the patient have that kind of sensation around anus, the hot sensation and heaviness sensation, this is due to the dampness and heat. So our treatments may focus on different causes of diarrhea, but for damp heat, sometimes you also may find the evidence from the tongue, such as the yellow coating, the red tongue with yellow coating. Apart from the exogenous pathogens, 黄帝内经 also described as the other possible causes from the climate. It described that if a patient suffers from wind attack, in spring, and then in summer, this patient may suffer from diarrhea. So from all these clauses, we can see that 黄帝内经 at that time, we understand that the causes of diarrhea may be heat, maybe cold, maybe dampness, maybe wind. Why wind? This is also related to the characteristic of a wind. The wind, when we study the wind, we have the characteristic of moving, constantly moving. Diarrhea, the bowel movement, the stool supposed to stay in the large intestine, but now it's moving fast. So something moving, that's the characteristic of wind. So the patient may present as a lot of air in the abdomen, so the noises in the abdomen. These are some of the possible causes. For diarrhea, we mainly focus on the spleen and the dampness. Spleen deficiency also may result in diarrhea. Apart from these, the emotion also may result in diarrhea. As the theory developed, there are many other schools and theories on the discussion of diarrhea. But no matter which school, what we need to do, we need to identify the causes. There's another diarrhea that commonly happens in elders. It's also the chronic diarrhea. The chronic diarrhea, especially if it happens in early morning at dawn. So this diarrhea, we refer to the kidney deficiency. Chronic diarrhea in the early morning, then we're going to focus on the kidney. The treatment for diarrhea, firstly, we need to strengthen the spleen. We need to focus on the dampness. But another very interesting treatment, what can we do is we're going to increase the urination. We're going to use some technique to increase the urination to stop the diarrhea. So that's another way. When we think about diarrhea, what happens to diarrhea is you got too much water in the large intestine. So if we can use some technique to guide the water of the body into the bladder, the water, the extra water, the excess water goes out from the body through the bladder, but not through the large intestine. Then we can stop the diarrhea. So there's some other technique that we can think about. The etiology. Exogenous pathogens that we have introduced. It may due to coldness, dampness, summer heat, and heat. And these exogenous pathogens, once they attack the spleen and stomach, it may result in dampness. So we will focus on dampness and spleen. And these two are also related. Improper diet, this is also very common. The improper diet also may result in internal coldness or dampness. Emotional changes, such as anger, stress, this may result in the liver qi stagnation. The liver is the wood. The wood will affect the earth. Sorrow or overthinking that related to the spleen also may result in the dysfunction of the spleen. So for the emotional changes, mostly you need to focus on the spleen. So what factors may affect the spleen? What factors may affect the earth from the 5-element theory? So there's some emotions that we can focus on. Others, such as recovery from severe diseases, that will result in deficiency. The deficiency may be the organs deficiency. The organs deficiency also may include the spleen deficiency. So it will result in internal dampness and result in diarrhea. So for diarrhea, mostly we need to focus on the spleen and dampness. Acute diarrhea, mostly excess. Chronic diarrhea, mostly deficiency. The deficiency we need to think about, is it spleen deficiency or kidney deficiency or both? So we need to select the treatments according to the differentiation. The location is the large intestine, but it's very closely related to the spleen. Our treatments also focus on the organs. Syndrome differentiation. Damp cold, damp heat. Damp heat, the patient will have the sensation of hot sensation around the anus. Hot sensation. Then the cold, the patient may, because of the coldness, the patient may suffer from abdominal pain, the noise, the air. White coating. Damp heat, yellow coating. For the retention, there must be a history of improper diet, such as excess alcohol intake or unhygienic food. The qi stagnation related to the emotion, spleen qi deficiency, loose stool with undigested food. So spleen deficiency, we always say that spleen deficiency may have loose stool, undigested food. So in this situation, you just need to think about, just imagine that the spleen in our body, the spleen is like the cooker. When you cook food, the utensils. The kidney is the fire, the kidney fire, the minister fire. The fire underneath. So the kidney, the spleen, the spleen deficiency, the kidney deficiency, these two may result in the undigested food, uncooked food. So you just imagine that if you don't have enough heat when you cook your food, the food will be uncooked. That's why the undigested food, this undigested food, the patient will tell you that they can see their food in the stool. So when you see the undigested food, you will know this patient suffers from spleen deficiency and kidney deficiency. Mostly spleen deficiency, but for after long term, the kidney may be affected. So for undigested loose stool, diarrhea with undigested food, you will focus on spleen and kidney. If the diarrhea in the morning before dawn, your treatment will focus on kidney. But in the meantime, you also need to focus on the spleen. This mostly happens in senior people. Although young people also may, the kids also may suffer, but mostly the senior patients, the kidney deficiency. They always have loose stool in the early morning, or even diarrhea in the early morning. It may be undigested. It also may be digestive food. So if accompanied with undigested food, you're going to strengthen the spleen function. Otherwise, you may focus on the kidney. So for the treatments, for the syndrome differentiation of the diarrhea, we need to differentiate is it acute diarrhea or chronic diarrhea. Acute may be a short period, may be more frequent. This also may be excess. For the chronic diarrhea, the patient may have a very slow onset, long duration. The diarrhea comes and goes. We also need to identify the coldness and heat. The coldness and heat can be seen from the tongue. We also can see from the description from the patient. For example, the smelling of the stool. If very bad smelling, yellow stool, very urgent passing the stool, or the patient will present as passing the stool urgently. The hot sensation around the anus is due to heat. If loose stool, clear, like watery clear stool with undigested food, these are mostly coldness, and deficiency. Thirdly, we need to identify the excess or deficiency. And lastly, we need to identify the syndrome, some syndromes such as the causes due to exogenous pathogens or the food retention. Liver, so from the syndrome differentiation that we have discussed just now. So for diarrhea, before you go to the treatment principles, you need to know the duration. Is it acute or chronic? Acute or chronic? Is it cold or hot? So for diarrhea, before you go to the treatment principles and the points, you need to identify is it chronic or acute? Is it cold or heat? Is it excess or deficiency? These will affect your treatment principles. Okay. For deficiency, you're going to tonify. For chronic deficiency, you're going to tonify. For acute, you're going to reduce. Acute excess, you're going to reduce. So we're going to focus on the large intestine. We're going to focus on the spleen and stomach. Number 25, we have mentioned previously in the abdominal pain. It can be used for both diarrhea and constipation. Round 8. The local points. Exu points. Number 37. This is the points I mentioned previously for the abdominal pain. For the large intestine and small intestine, the low C points, you also can think about. Spleen 6, focus on the spleen. And then you can plus on other points that according to the syndrome differentiation. You will see that for deficiency, we will for the diarrhea, we will strengthen the spleen function. For dampness, we can use stomach 9. Number 39. For the low C points, large intestine 4 can create the heat. You also can add liver 3. We have mentioned quite a few times. For the retention, because this is related to the stomach, the full meeting points, also the local points, round 11. Liver qi stagnation, 14 and 3. Needle technique, round 8, you can use the Moxibustion with fuzi or ginger to increase the heat. Kidney yang deficiency, you also can use Moxibustion. So just in general, for yang deficiency, for coldness, you're going to focus on Moxibustion. Acute, once or twice a day. Chronic, once a day or every second day. So this also can be used for chronic diarrhea. Beizi, this is a herbal medicine. You can apply on round 8, Sunche. In this video, we mainly discuss diarrhea, similar to the abdominal pain. For each disease, we need to focus on the differential diseases, the differential symptoms. In the next video, we are going to talk about the constipation. For diarrhea and constipation, there's something related to the bowel movements. When we see a patient in clinical settings, if the patient have the changes in their bowel movement, in the habits of their bowel movements, apart from treating the diseases, we need to be careful of to exclude the possibility of cancer, especially the sudden, not the sudden, especially if the patient presents as the changes on the habits of the bowel movements. So some changes, especially if the patient presents as changes on the bowel movements, the habits of bowel movements, we need to exclude the possibility of cancer. For the treatment of diarrhea, no matter acute or chronic situation, the diet is very important. And no matter what kinds of causes, at least we need to exclude the factors from the food, the diet. So the patient should avoid greasy food, spicy food, and ice cold food. So cold food. And also need to look after the hygiene in their food intake. Thank you for your attention.